We have for long identified circulating tumor DNA fragments in the serum, and more recently we have identified that those tumor DNA fragments also are filtrated into the urine, where we identify them in a higher concentration than we see them in the serum in the first place.
So this is particularly important, I believe, for patients who have a low tumor burden, where their circulating DNA may be relatively low. So in those patients, you may have a fairly high concentration of DNA in the urine and then be able to perform the genomic analyses.
Then the identification of those very molecular changes, like the T790M mutation, doesn't only allow us for the primary identification of this mutation in the urine and then the appropriate treatment selection, which is at this very point in time osimertinib or AZ9291, but it also allows us for a very easy way to establish a molecular response. With other words, if we identify the mutational burden at a certain level in the urine initially and expose the patient then to the appropriate treatment, we would very much expect this mutational burden in the urine to decline very soon after therapy. And there is data that shows that this mutational burden decline within the urine can be identified within the first week of the patient's treatment, way earlier than imaging could detect such a response.
That's particularly interesting, and I think it's going to be very useful for taking care of patients. We believe, and so others are saying, that perhaps because of the heterogeneity in tumors, that looking at the circulating DNA might give a better indication of what is actually going on in that tumor. The other part of this, and this is obviously still in a research area, looking at serum protein panels may also be something that's very important to tell us what's going on in that patient, because the tumors aren't existing in a vacuum. There's interaction with inflammatory cells, immune cells, and possibly a serum DNA signature along with the serum protein signature may be something that's useful in taking care of patients in the coming years.